In today's society, we're sitting more than ever. I think this is having a huge effect on our body and our muscles. Today, I'm going to be discussing a group of muscles called your hip flexors, why they get tight, things to look out for to see if you've got tight hip flexors, and how to stretch them out properly. Hello, it's Andy from the Movement Project, bringing you the latest research to create practical solutions to your health and well-being. And today I'm going to be discussing a group of muscles called your hip flexors. And the reason why I thought I'd talk about this, I think that they're a really overlooked muscle. Partly the reason for this possibly is that it's a muscle that we can't really see and it's hard to actually feel to see if it's tight. It's an intrinsic muscle inside our pelvis. It attaches on the inner part of our spine and then comes right down and touches onto the front part of the leg. So the hip flexor's purpose is to lift our leg. Also, it leans us or bends us to the side. It can also hinge us forward at our hips, so when we sort of bend forward. It's really important that we keep this muscle functioning well because it will have an effect on our spine and our lower back. Just something to consider if you're also thinking that you might have tight hip flexors is when you sit down on the sofa, do you sit on a portion of the sofa that has an armrest always on one side and you tuck up your feet on the opposite side? What this will do, it will put this muscle in a really shortened position, and if you're sitting there most of the day, then this one inevitably is going to get tight over a long period of time. Okay, so how do we see if this muscle is tight? What you do, if you lay onto your back and then you bring one knee towards your chest, what you should find is that the other leg that's on the floor should stay relatively close to the ground. Now, if this muscle was tight, what you'll find is that the other knee will want to come up and you'll have an angle or a gap behind your knee. So then we'll know that this muscle is tight and needs stretching. Okay, so how do you stretch this muscle properly? Now, it's something I see so often that patients stretch this muscle incorrectly. And it's so easily done, it just needs a slight alteration to make sure you're putting all the pressure of the stretch onto this muscle. Okay, so how do we stretch this muscle properly? Something I recommend, if you get a yoga mat or you can get a pillow for the knee that's contacting the ground, what you'll find this just feels a little bit more comfortable, but you don't have to use this. And then you get into a kneeling position. Now, one way that I find that patients do this incorrectly is they'll just do a lunge forward. So they'll be really relaxed and then they'll sort of lunge forward as far as they can go. And what this does, it doesn't keep the pressure on the muscle and allows other areas to do some of that movement. So what we want to do, if we remember the anatomy, muscle attaches from the lower back to the front part of the leg. So we want to get these 2 points as far away from each other as possible. And to do this, what I recommend is you tilt the pelvis back. Now, to do this, you want to tense your core and also your glute. So as you keep stretching, you keep tensing your glutes and your abdomen. And what you'll find is immediately you'll feel more of a stretch onto the front of the leg and it'll be a lot more difficult. Now, if this muscle has been tight for a long time, it can be a little bit grouchy if you just try to start doing really strong stretches on it. A way I like to do is if you just gently hold the stretch for maybe 3 to 5 seconds, then you ease off and then you go again, and you can do that for roughly about a minute. After a time, you can then start doing more static stretches, especially after exercise. That's a great way to loosen this muscle off. Also, when you do start exercising, if you start running or if you're doing any other form of physical activity, you'll find that this muscle will start loosening off on its own. But it's really important that you do start stretching as well. That can just speed up this process. Also, then you're less likely to get other injuries as a result. Okay, so I really hope you've enjoyed that video and I hope you've found some really useful tips that you can implement into your daily life. If you do have any other questions, please put them in the comment section below. Once again, subscribe to the channel and like the video. It really does help out. Thanks very much for watching.